When should you stop breastfeeding? The World Health Organization recommends that babies be exclusively breastfed for the first 6 months of life. After that, solid foods should be added and breastfeeding continued until at least 2 years of age or beyond. But what if you want to stop breastfeeding before your little one is 2? How can you tell when your baby is ready? And when is it okay to quit? We asked experts to weigh in with guidance on knowing when it is time to wean and how to do it safely. Here's what they had to say. It can be tough to know exactly when your baby is ready to stop breastfeeding. It often depends on a number of factors, including your baby's size, development, and nutritional status, says Dr. Laura Riley, Chief of Obstetrics at Massachusetts General Hospital and an Associate Clinical Professor of OB/GYN at Harvard Medical School. Of course, the decision of when to wean can also be based on the nursing parent S and child S inner needs, along with practical considerations relating to the family. However, there are some situations where it is best to put off weaning until a time when conditions are better. Here are 3 examples of when you may want to delay weaning. No. 1. When there are food allergies in the family. If you or your child's other parent have experienced food allergies, talk with your pediatrician or other health professional about the benefits of delaying weaning. You may want to wait until at least after your child's first birthday. Recent studies show exposure to potential allergens while the birth parent is pregnant and while breastfeeding may actually prevent allergies in the child. So restrictive diets during these times are no longer recommended. No. 2. When your baby is sick. If your child has a cold, is teething, has recently been hospitalized, or is otherwise not in tip-top shape, put off starting the weaning process until they feel better. You might also want to delay your first attempts to wean if you feel under the weather. It is always best to meet any transition period when you and your child are at your physical and emotional best. No. 3. When other big changes are happening. If you are pregnant or have recently had a new baby, this may not be the best time to wean unless led by your child. On the other hand, your needs and the needs of a newborn may take priority. Always breastfeed the newborn first, but try to be sensitive to the needs of everyone involved. Likewise, a move to a new home, a marital disruption, a new childcare situation, your return to work, and other potentially stressful situations are not the best times to begin another major change. Ideally, you will begin weaning when it's not overly stressful for you or your child. The process of weaning doesn't happen overnight. It can take some time for both you and your child to adjust. The length of time varies from child to child. Some babies wean quickly, while others take more time. It is important to remember that every child is different, and there is no right amount of time to spend breastfeeding. Ultimately, the decision of when to wean is up to you, your baby, and your family. But your pediatrician can help you decide what might be best for you. If you are planning to start solids soon, or are just getting started with solids, your pediatrician may assess your baby, weight and growth to determine if your baby is ready to eat more solid foods and drink less milk. Your pediatrician can also look at your baby's developmental milestones to see if your baby is developing as expected. Babies who are developmentally on track tend to have the skills needed to self-feed. This means that they can sit upright with support, move food from the front to the back of their mouth, and move food into their stomachs by swallowing. When it comes to your baby's nutritional needs, your pediatrician can explain how much nutrition your child should be getting from breast milk versus solid foods. And your pediatrician can talk to you about whether your baby's diet looks like they're getting all the nutrients they need. Weaning is a gradual process. Your pediatrician can advise you on the best approach, whether that is decreasing the number of breastfeeding sessions over time or replacing one session at a time with a solid meal. And if your child is showing signs of readiness, your pediatrician can offer tips on how to start weaning. In general, experts recommend that you make one change at a time. For example, if you usually nurse your child on demand, try limiting nursing sessions to certain times of the day. Or if you typically breastfeed at night, try waking your child for a bottle of formula or milk so you can get some rest. Whatever approach you take, go slowly and be patient. Allow yourself time to adjust to the changes. Keep in mind that setbacks happen and it's normal to go back and forth between nursing and other milk options. Weaning can be an emotional time for both you and your baby. As your child gets older, they may protest as you replace nursing sessions with other milk options or solid foods. Some babies will fight the change, while others will accept it without much fuss. You may feel sad or even grieve the loss of your breastfeeding relationship. These feelings are normal and should not be dismissed. Make sure to take care of yourself during this transition and reach out for support if you need it. Talk to your partner, friends, family members, or other parents who have gone through the weaning process. You may also want to join a support group. Remember, there is no right amount of time to breastfeed. The decision of when to wean is up to you, your baby, and your family. Work with your pediatrician to decide what might be best for you. And don't be afraid to ask for help and support during this transition. To learn more about infant feeding, visit healthychildren.org or newbornnu.org and check out the links below for more information on this topic. Thank you for watching. Be sure to subscribe for more health and wellness videos.